So, given recent immigration policies, we do see a decrease in individuals willing or comfortable studying in the United States, and particularly this is affecting individuals in graduate level programs and other professional programs like law schools and medical schools. In particular, when you're talking about healthcare professionals, we have a lot of healthcare professionals that come from other countries that immigrate or come on educational visas to study in the biosciences, and that may be a PhD for bench research to be able to look for a cure for cancer, or it may be more practical clinical studies going to medical school or nursing school or dental school. We're making it very difficult for individuals, besides just obviously the world knows that there's a negative climate for immigrants in the United States right now. But beyond that, because of this, there's talk of actually decrease in the funding that graduate students would be able to get. And when you are an immigrant coming into the country, your primary way of sustaining yourself is going to be through graduate stipends. This is happening outside of the immigration policy. This is part of kind of what's come about more recently as there's talk about reducing graduate stipends and taxing them in a way that would essentially cut them in half, making it essentially unlivable for people to be able to sustain themselves on any type of graduate assistance that they would have. So with this decrease in individuals being willing or able for financial or other reasons to study in the United States, we see a drop in the number of people that are willing to become providers within the country. So one, it's going to decrease the number of medical and healthcare providers that we have, but also I think there's an additional loss in that we know from having the more diverse researchers or practitioners that you have, the better medicine that you have. So it's not just we're decreasing the numbers, but people who come from different backgrounds bring different perspectives on science and research questions, which actually improves the quality of the science and the research that we're doing, because it's less likely that we'll all have the same biases as we enter into the scientific or medical process. So it actually makes the quality of our healthcare system better by having different perspectives and different minds working on the problems that we have. So I see it as a significant loss, not only in terms of we have fewer numbers of people willing to study and practice in the United States, but I actually think that it will lower the quality of our healthcare because we won't be able to benefit from the different perspectives people from different countries, cultures, backgrounds, et cetera, bring to our medical and our clinical practices. Hospitals and their staffing levels. I think that we have shortages generally in the United States, particularly with nursing staff. We don't have enough nursing staff, but also I think that it affects rural communities the most because we have fewer people willing to work in rural communities, and when you decrease the number of people that are willing to practice or capable of practicing, that means you're pulling resources from communities that desperately need desperately need practitioners in their area, and typically general practice or rural practice is one of the least popular specializations. Things like, the big money makers like neurosurgery, plastic surgery, et cetera, people are drawn to. So I think that it's a negative in terms of it pulls from already kind of under-resourced areas. But I also think that it's just a general loss for our health professions in particular. Obviously, it increases wait times, the ability to access or get appointments, and so it generally just lowers the standard of care that we have across the board.
Earlier, Dr. Bulcock stated that there is an increase of wait time. In 2014, the average emergency department wait time is about 30 minutes, and the treatment time is about 90 minutes, which adds up to roughly 2 hours in the emergency room.
Graduates of foreign medical schools have approximately 18% of biomedical research and clinical trials. They run them. And this loss would greatly impact many studies and opportunities for communities and patients in needs. And primary caregivers and specialists are really needed across the country, so I feel that this would be a great loss if we had a decrease in medical providers.
Donald Trump travel ban is banning 6 different countries from being able to become U.S. citizens. These 6 countries account for 14 million doctors appointments each year in the U.S. according to the Immigration Doctor Project. 94% of Americans live in a community with at least one doctor from an affected country.